Hello, I'm Maura Carley, founder and president of Healthcare Navigation, here today to talk to you again about the out-of-network benefit. The out-of-network benefit is very sought after, but very misunderstood and potentially financially devastating when you don't understand it. So let's go through this. We talked about the in-network benefit before. By definition, if your provider is in network, there is a contract between your provider and your insurer. And by definition, when there is no contract between the provider you want to go to and your insurer, you are out of network. Now, there's often a separate out-of-network deductible. We talked about deductibles before, so we're not going to go through that again. But often the out-of-network deductible can be an amount which is very high, like $10,000 an individual. So that's one problem. The other problem is that people look at the co-insurance amount. Again, co-insurance. That's when you are sharing responsibility with your insurer for the cost of a claim. And the percentage can be just about anything, 90-10, 80-20, 70-30, 60-40, 50-50. So you need to understand that. The misunderstanding comes in thinking that the percentage displayed as the insurer's responsibility is actually the percentage of the claim they will pay. And that's not true. They will pay that percentage associated with their allowed amount. And you typically don't know what that is or even what it's based on. We can talk about that another day. But that means that when a claim comes in, you would be responsible for the deductible. Let's say you've even met the deductible, which sometimes is a miracle, but often not. But then if your insurer, let's say, is going to pay 80%, your obligation is to pay 20%, but 20% of the allowed amount. And the problem with an out-of-network provider is because there is no contract between them and the insurer. There's really theoretically no limit on what they might charge. And sometimes the charges appear, at least to us, wildly unreasonable. And so that what's called the excess charge above the allowed amount is entirely your responsibility, and it's not applied toward your out-of-pocket maximum, which I realize we haven't talked about yet, but it doesn't help you get to that level where the insurance company is responsible for 100% of the cost of your claims. So I went back into the archives. And you know what? I should have said earlier, we have some pretty good educational materials, at least we think they're pretty good, on our education tab of our website. And one is Health Insurance Basics, which covers much of the same material in a much more condensed way than I'm doing on these videos. But we share a fairly benign example of an out-of-network responsibility, although it's still a lot of money, $8,500. But I went back into the archives when costs were much lower. And to just give you a couple of examples, one was in the book I wrote in 2012, where a hospital had charged originally $500,000 to an uninsured person. They're at the same kind of risk, obviously even more so, but the next example I'll give you will underscore how close the situation can be between being uninsured and out of network. So anyway, this fellow let his COBRA expire. without arranging subsequent coverage and was self-pay at a hospital. The hospital originally charged $500,000, but accepted ultimately $139,000. And that's one of the case studies in my book. And this is an example from many years ago. So the stakes are much, much higher now. But we had another client. Again, these are not our ongoing clients. We do a good job protecting them from these situations. But this is someone who came to us with a dispute. And she had two surgeons involved in a surgery. I will just mention one. She ended up being out of network, which frankly was a little unfair. During the year, her insurer changed the network from including access to New York City physicians to excluding it, and their communication could have been far more effective. So anyway, the amount billed for one of these physicians was roughly $70,000, and the amount allowed was $4,600 by the insurer, so she owed a portion of that. Anyway, her total responsibility was close to $65,000, $64,825. And she had another surgeon involved in the surgery who charged a little bit less, closer to $50,000, but with similar kinds of math here. So a pretty significant dispute. So remember, if you're out of network in a situation where the provider is totally unknown to you, you have to be particularly savvy about this kind of issue. If you've been out of network with a provider you've known for many years and their charges are reasonable and you're happy to pay them, that's an entirely different situation. We're addressing here today the situation where you believe your insurer is going to cover so much more than they actually will cover. So as you can see, because of what's disallowed here, it's almost impossible to meet the out-of-pocket maximum for an out-of-network benefit, which we'll be discussing soon. So in many of these situations, we advise, as much as people don't like discussing money with providers, physicians, and their staffs, trying to find out what you're going to be charged. And that can be a project, we know, but it's only reasonable if you're going to have significant financial responsibility that you understand what you're in for. And we're going to talk about the details of that in another session, because it can be a bit of a project, as you can imagine. If you're going into the hospital, there's going to be a number of providers involved in your care, and you want to find out what they charge, and you want to try to work with your insurance company to find out what they will pay. And our experience with that varies tremendously. But this was a lot of information today, so I think we should say that's it for today. Thanks for listening, and I look forward to seeing you again soon. Take care.